The pandemic has health workers exhausted, and many of them are now leaving their profession. Sean Boyd joins us now with more on this. And Sean, this is certainly a disturbing trend.
Yeah, you know, we had a shortage of healthcare workers before COVID. Now there are critical shortages in some places. Many nurses and doctors are simply quitting, and there's not enough students in the pipeline to fill the void. In an effort to stop the bleeding, a disaster preparedness coalition of health organizations is taking action. You don't need a survey to know healthcare workers are burned out, and many are leaving the profession altogether. What we don't know is exactly what is driving the exodus. A first-of-its-kind survey in Colorado aims to answer that question.
We can't afford to lose any people prematurely out of these workforces, right? I think that's the key point. And so the idea is to try and direct this in some ways. Is there something we could do to retain them?
Zeke Peters is a 30-year paramedic and member of the North Central Region Healthcare Coalition, which commissioned the survey that he says is aimed at giving healthcare workers a hearing.
A lot of people who've taken this find it, for lack of better description, very therapeutic. There is someone listening, and we would really like to give people that hearing.
It's for everyone from doctors and nurses to hospital IT workers and orderlies.
If we are about to have a mass attrition of people who are actually competent at cleaning rooms to kill all the COVID in them, right, then we're in a lot of trouble.
They also want input from former and future healthcare workers.
Particularly those students who might have been sort of like, well, I think I'd like to have a career in emergency management, but you know, I think maybe it doesn't look so good anymore, right? And that's actually what we would really like to know about, because maybe there's a way to say, well, hold on a minute. There's actually a lot of opportunity here.
We need everyone's, as many as possible's input on it.
Colleen Casper, executive director of the Colorado Nurses Association, says even now, ICUs in Colorado are 90% full.
It's not just burnout. I mean, it is moral injury that they cannot provide the care that they want to be able to give, and they know that these patients deserve.
She hopes the survey results will be a wake-up call for hospitals.
I feel like this pandemic in this survey is a way to inform ourselves and save a workforce that is at great risk.
We will not be able to respond again. And we will not even be able to finish this response if we have this kind of attrition.
Peters and Casper say about 1,000 workers have responded to the survey so far, and that many hospitals refuse to distribute it. It'll be open at least another month, and we will have a link to it on cbsdenver.com. And Karen, I was asked to stress it is completely confidential.
All right, we appreciate that, Sean. Thank you.